Welcome to COVID Conversations, where we discuss the latest COVID-19 news with the experts. The CDC recently posted new guidelines about mask wearing, including doubling up on masks in certain situations. So is wearing two masks more effective in stopping the spread of COVID-19 and its variants? Are there any instances where this might not be necessary? And for how long are we going to need to wear masks? Mary Salvia is the Director of Infectious Disease at Beth Israel Deaconess Medical Center, and she joins me now. Dr. Salvia, welcome.
Thank you. Thanks so much for having me.
Today's question is, what are the latest guidelines about wearing a mask?
Sure. So, I think that while it seems like a lot is changing, in reality, we're really learning more and more about reaffirming what our basic principles around mask wearing are. And that really is that masks work best when everyone's wearing them. So if I wear a mask, it helps to protect you. If you wear a mask, it helps to protect me. And if we both wear masks, then we're doing everything we can to protect each other. And I think that what we recognize is it's very important when you're out in public to wear a mask, or when you're in your home with individuals who don't live with you. And then I think what we also are learning is that there's two really key principles about the mask wearing itself, which is that fit is important, and really the layers of masks are important. And so we'll start with the fit. I think the important part about the fit is that masks are most effective when they're completely covering your nose and your mouth. And also when they fit snugly enough that there isn't a big gap at the sides of the masks. And so the fit's important, where you want a mask that isn't very loose. You want a mask that's fitting well against your nose and your mouth, covering both of those and fitting tightly against the sides of your face. But also obviously such that you can breathe comfortably. And then what we also know is that the recommendations are to wear a mask that has two layers. And so I think some people are thinking about this as, well, does two layers mean two masks all the time? And the reality is that a lot of masks people wear are very different. But the best types of masks are those that have a tightly woven fabric, meaning that there's not a lot of gaps or space in between. And so often those are either cloth masks or non-medical masks that you can buy at your local drugstore, CVS, Walgreens, that are now increasingly available for people to wear, much more so than they were at the beginning, about a year ago. And so we want the masks to have two layers. And what that means is that for some individuals who like, sort of a looser fitting fabric, sometimes adding a second mask on top of that would make it much more effective. But if you have a good cloth mask with two layers that has the right fit, then that's the right mask to be wearing. Or, getting a medical mask or sort of like a non-medical mask that you can purchase at one of your local stores that has more than one layer to it that serves that same purpose and that fits around the nose snugly and covers your mouth well. So it's not really about more than one mask. It's about having the right either combination or the right qualities to that mask and ensuring that it's fitting well.
That's good to know. So there really aren't going to be like different scenarios where you would need to have to double up on masks. It's the layers that you're saying.
It's the layers, exactly. It's the layers and the fit. And the situation doesn't really change that, because if you're wearing a mask, you want that mask to be effective. And so for it to be as effective as possible, it's really two layers and having the right fit to it.
And we know, of course, people are getting vaccinated. It's exciting to see, but then you also have, well, now I'm vaccinated, so I don't need to wear a mask. But that's not really the case. Is that correct?
That's right. I mean, I think we are still learning so much. I think we've learned, just think about what we've learned now compared to a few months ago. And really, we're in a place now where our guidance around masking is thinking about how we benefit our community as a whole as much as possible. And our goal is to drive down the rate of infection as much as possible and to keep our community as safe as possible. And so with that, that means we're really still in a place where to keep everyone as safe as possible, we need everyone to do their part and to wear their masks, not only to protect yourselves, but to protect each other. And I think that we're, again, this is something we're still learning about. And so what we're most actively learning about now are, really how well do the vaccines work over what time period. We know they're very, very safe and effective, but we're also learning about more and more, does the vaccine prevent you from having asymptomatic infection that you may be able to spread to others? And there's a lot of new data coming out that's incredibly encouraging. But we really need some more information before we can put out more guidance and feel comfortable about eliminating masking in more situations. So I think this is a time where we really need to, kind of dig deep, continue the measures that we think are most important. Let us accrue the information that we need and really continue to learn to put out the best guidance as possible for everyone. But we also have to recognize, masking can be hard, and we all want to go back to, our normal day-to-day lives and get rid of the masks because they can be frustrating and uncomfortable to wear sometimes. But I would say we're not quite there yet. We need to really learn more about not just the vaccines, but also things like the new variants and the new types of COVID strains that we're seeing, and make sure we have a full understanding to put out the best recommendations as possible for everyone.
Science is ever evolving, so
science,
we really,
that is very science is ever evolving, but we're definitely learning quickly as we go.
Excellent, excellent. This is great, super valuable information, Dr. Salvia. I so appreciate your time. Thank you so much for joining me.
Absolutely, thank you, and stay safe, everyone. Thank you.
Thank you. Everyone, this is COVID Conversations, where we discuss the latest COVID-19 news with the experts.